Right now, the health department says it's open for additional booster doses for individuals at high risk. These include adults between the ages of 18 and 49 years and all children aged between 5 and 11 living with conditions that place them at risk of severe COVID-19 disease. Let's unpack this further now. We're joined by child health specialist Dr. Leslie Bamford. Thank you very much, Doc, for joining us here on eNCA. Now, of course, a lot of people in South Africa would, think that there's a reason to worry or be cautious whenever the health department announces booster shots, etc. Is it necessary for us to panic?
So, good morning and good morning to the viewers. There's certainly no need to panic. We know that the number of COVID cases and certainly the number of people hospitalized with severe disease is low at the moment. However, having said that, we do continue to admit people to our hospitals with COVID. We continue to see, unfortunately, still people dying from COVID, a small number, but we know that people do remain vulnerable to COVID disease. So certainly no need to panic, but as you correctly indicated, we're sending a clear message that the pandemic is not yet over, and we continue to urge people to make sure they are protected through vaccination. Vaccination remains the best protection against COVID disease, particularly severe disease, but all forms of COVID, including long COVID. So we really urge people, particularly those who have not been vaccinated, to come forward and get vaccinated. But those who are vaccinated or have started their vaccination journey should ensure that they have had all the doses for which they are eligible.
So basically what you're saying is that the booster shots are available. So if, for example, somebody like myself who got her third shot, which was a booster, of course, back in March, by now, am I eligible to get yet another one, or can I wait a little longer?
So what we have announced is we have had many queries from people asking about additional boosters. We're not making additional boosters available immediately, but we anticipate that these will be made available early next year, probably in February, together with doses for children 5 to 11 years who are at risk for severe COVID. So currently, all adults 18 to 49 years of age, are eligible to receive a total of 3 doses, and people 50 years and older are eligible to receive 4 doses. So in the statement that was released, we are looking forward and providing some information as to what we anticipate the future will look like, starting early next year, as I say, probably in February, but also then urging everyone to make sure that they have had all the doses that they are eligible to receive.
2 questions of just clarity, please, Doc. In terms of booster shots, you're saying right now, if I had to go to one of the centers, I will not receive a booster shot unless I go in February. That's clarity question number 1. Clarity question number 2, when you say adults between 18 and 49 are eligible to get 3 doses, do you mean 3 at the same time? Because these are booster shots, right? So if I've already had my first booster shot after receiving my Pfizer last year, already I have 3. So am I enough, or do you mean I need 3 more?
So no. So the doses I referred to were total number of doses.
Okay.
So adults 50 years and younger, if they've had, like yourself, if you've had a total of 3 doses, then you are currently up to date with your vaccination. We talk about 3 doses because some people had 2 doses of Pfizer plus 1 booster, and some people had 1 J&J followed by 2 boosters. So most adults should have had, or younger adults should have had 3 doses, and those of us who are 50 years and older should have had a total of 4 doses. And if we have had that number, then we are considered protected. But because we know that immunity does wane over time, there is an expectation that early next year, additional booster doses will be made available.
And my other question, so they're not available right now?
Not right now,
Okay.
but early in 2023.